Hello, my name is Colleen Butler, and I'm a registered nurse and a family nurse practitioner student. This is my presentation on the family nurse practitioner's role in leading evidence-based practice. The purpose of this presentation is to discuss the significance of evidence-based nursing practice and the obligation of the family nurse practitioner to lead change and establish a culture of evidence-based practice. After reviewing the article called Nurse Practitioner's Implementation of Evidence-Based Practice into Routine Care, a Scoping Review, it is evident that while nurse practitioners understand the importance of evidence-based practice, there are some limitations and barriers to effectively implementing change based on evidence-based practice. Key areas to be covered in this presentation are evidence-based practice by nurses and why it is crucial in healthcare, the challenges to implementing change based on evidence-based practice, the family nurse practitioner's obligation to be a leader of change, and my personal clinical experience of evidence-based practice. Evidence-based nursing practice involves the most current and up-to-date research evidence combined with the nurse's clinical experiences and expertise, as well as the patient's preferences and values. Evidence-based nursing practice is crucial to healthcare and nursing because it provides the patients with quality, holistic care using the most up-to-date research and knowledge while respecting the patient's values and preferences. It is important for all nurses to use the most up-to-date research and knowledge because this ensures that the patient is receiving the most current recommendations that have been proven with research. Using evidence-based practice promotes positive patient outcomes, ensures relevant nursing interventions, increases the nurse's confidence in their decision-making, encourages lifelong re-education of the nurse, and reduces healthcare costs by reducing medical errors, preventing complications in the patient's treatment, and increasing efficiency. Having the most up-to-date information on how to best treat the patients for their conditions will yield the best outcome for the patient and the healthcare team. At the same time that the nurse is using the most up-to-date information, the nurse needs to also be using their clinical expertise because there are not any two patient scenarios that will be the same, and the nurse needs to respect the values or wishes that the patient has regarding their treatment and their health. The article called Nurse Practitioner's Implementation of Evidence-Based Nursing Practice into Routine Care, a Scoping Review, provides insight on implementing evidence-based practice as a nurse practitioner. This article demonstrates the principles of evidence-based nursing practice in action by discussing some studies that were identified during research in which they found that nurse practitioners were involved in guideline development and quality improvement projects based on evidence-based practice. The article also discusses the challenges for nurse practitioners to implement evidence-based practice changes. For example, in order to implement evidence-based practice changes, the nurse practitioner must be able to have the support from and collaborate with other providers in the practice. Unfortunately, nurse practitioners are often not taken as seriously by doctors in their role, expertise, or contribution to their profession. Nurse practitioners would need the support of doctors and other members of the practice in order to implement changes. This article discusses the evidence-based practice implementation scale, which is used to determine nurse practitioners' implementation of evidence-based practice. The findings showed that nurse practitioners were able to implement evidence-based practice into care of individuals, but has less evidence showing that evidence-based practice was implemented into the routine care of a patient population. Nurse practitioners were shown to use clinical courage to implement a change in an evidence-based protocol in routine care. The family nurse practitioner is uniquely positioned to lead changes in practice and promote evidence-based learning. Nurse practitioners can be seen as leaders because of their advanced education and skill. Because of their advanced practice role, nurse practitioners should be leading practice changes across units in order to standardize patient care using evidence-based practice. Standardizing care using evidence-based practice would promote positive patient outcomes in the most cost-effective way. Nurse practitioners can use their experiences working with a variety of patients as an advanced practice nurse, along with evidence-based practices in order to best determine how to treat each individual patient. If nurse practitioners were to treat patients based solely on their experiences, the patient might not be getting the best up-to-date treatment in the most cost-effective way. Nurse practitioners value evidence-based practice and believe it is an important aspect in caring for patients and implementing new clinical practices. Nurse practitioners can use their role as leaders in order to foster a culture of inquiry and continuous improvement by staying educated on the most up-to-date evidence-based research, educating the staff on new practices, holding meetings with information about these new practices, and mentoring nurse practitioner students or new nurse practitioners. By doing so, this will encourage other nurse practitioners and nurses to stay educated in order to give patients the best quality care. My proposed clinical intervention is an evidence-based support and education program for healthcare follow-up and prevention of infections and other poor health outcomes among refugees. An anticipated clinical experience of mine in which an evidence-based nursing practice could make a difference would be if my evidence-based clinical change was implemented at the refugee clinic where I am currently working. This clinical change, based on evidence-based research, involves developing a supporting and educational program for refugee patients in order to educate them on the importance of regular healthcare follow-up and preventative care such as immunizations or other poor health outcomes. I would advocate for an evidence-based change in this scenario because I can see where there is a lack of support and resources for new refugee patients and where evidence-based research would be beneficial to improve patient outcomes and satisfaction. The family nurse practitioner's commitment to leading evidence-based nursing practice is imperative to ensuring that the patients are receiving the highest quality of care in the most cost-effective way. Family nurse practitioners should be viewed as leaders in healthcare and should use their advanced practice nursing in order to implement proven evidence-based practice changes in order to provide holistic quality care for all patients. And then on this slide here are my references, and thank you for listening to my presentation.